Hello everyone, welcome to the online class of Chinese medicine gerontology. Today we will study the second part of chronic obstructive pulmonary disease, focus on studying the syndrome differentiation treatment of traditional Chinese medicine for COPD. First of all, the principle of syndrome differentiation and treatment is to grasp the key of excess and deficiency. The acute exacerbation period is biased toward the excess, and the stable period is biased toward the deficiency. If the acute exacerbation period is biased toward the excess, it is aimed to exogenous evil. Flame heating, lower gas and flame. Drinking water and dampness, 温阳利水. Blood stasis, promoting blood circulation and removing blood stasis, etc. Those who are at the stable stage of deficiencies mainly use the methods of supplementing the lung and spleen, replenishing kidney and qi, or invigorating qi and nourishing yin, or yin and yang. When the righteousness is about to get rid of, you should support the right and get rid of the yin and save the yin and return to the yang. Due to the relatively stable condition of patients in the stable period, TCM syndrome differentiation treatment has a significant effect on improving the clinical symptoms of the elderly and slowing the progression of the disease. In the specific classification treatment, according to the difference in the severity of the disease stage and the facts, it can be roughly divided into the following syndrome types, which can effectively guide the clinical. Let's look at the list. From the list, we can see the acute exacerbation period is more acute and the condition is more serious. And it is easy to change the syndrome. Syndrome types are more common in drinking cold and drinking outside, flame heat, flame turbidity, flame stasis, and even yang deficiency water. At the same time, the treatment should take care of the positive side and correct the evil, or both attack and supplement, or first attack and then supplement, or make up first. The stable condition is relatively stable, and the medium and long-term effects are remarkable. The method of nourishing the earth and producing gall is often used, represented by Shenling Baizhu powder and Yupingfeng powder. The method of replenishing lung and kidney, representing Bufei decoction and Gecko powder. The method of replenishing kidney and eliminating flame, represented by Jinshui Liujunjian. 补肾纳气 method, represented by Qi Wei Du Qi pills, ginseng and walnut decoction. 益气活血 method, 补阳还武 decoction. The main points of differentiation of each syndrome type. 1 is to grasp the characteristics of the main symptom. Cough, flame, swelling, and purple are the main symptoms and signs. But the manifestation of each syndrome type is different. The focus is different and the severity is different. The second is to grasp the characteristics of companion syndromes and determine the symptom type through the companion syndrome. For example, in addition to fullness or of abdominal distension and flame turbidity, flame and flame are also manifested by deficiency of lung and spleen qi and tongue and veins. Flame fever, in addition to showing fever, irritability, red face, red urine, yellow urine, dry stool, also have the characteristics of bruising such as thirst and desire to drink. Mutation of flame and blood stasis has signs of blood stasis, generally manifested as dull completion, cyanosis of lip nails, dark purple tongue, bruising under the tongue, etc. Flame monitoring psychiatric symptoms are mainly accompanied by mental changes and limb convulsions. The change of consciousness is more complicated. But it is nothing more than inhibition and excitement. It is clinically manifested as unconsciousness, delirium, irritability, an emptying of lines, abnormal behavior to indifferent expressions, drowsiness, and coma. The syndrome of yang deficiency and water flooding is special. The syndrome of yang deficiency and water flooding has both lung, spleen, and kidney yang qi decay, and water drinking insight, as well as a sinus blood stasis. Even the whole body edema, actis, etc. Drinking water on the heart and lung caused by palpitations, cough can all lie flat. It also needs to be mentioned that the prevention and treatment of aging disease is evil. The elderly are susceptible to external factors, and the image of right and evil is not typical. Therefore, cough and asthma suddenly increase, the color of the flame turned yellow, and the tongue became red. Although there was no evidence of fever and cold, the existence of external evils should also be considered. Focus on observing changes in color, quality, and quantity of flame, and make comprehensive judgments in combination with the whole body. On the law, in addition to the etiology or adjustment of the internal organs, symptomatic treatment is also needed, especially for the symptoms of spleen and swollen and purple swelling. For asthma, lowering and relieving asthma, and napping and asthma are usually taken. For drinking water, warming the kidney and strengthening the spleen, diluting diuresis, etc. For blood stasis, removing blood stasis. For unconsciousness, just opening the mind. For convulsion, extinguishing the wine and stopping span. Especially lung status is a chronic pathological process, damaging righteousness, and can produce new pathogenic factors, forming a viscous circle. Clinically, it is flexible to use the 浸润通络 method and the 补血通络 method treatment. Representative prescriptions and addition and subtraction of the medication. Master the key prescriptions. The first is 小青龙 decoction. This prescription is a well-known one for the treatment of external cold and internal drinking, so it is unnecessary to talk about it. The second is 苏子姜鸡 soup. This prescription is a well-known one for the treatment of cough and asthma of 上肾下虚. And the medication group has characteristics. 上肾, or excesses in the above, refers to the phlegm and saliva, and 下虚, or deficiency in the bottom, refers to the deficiency of kidney yang. Asthma, expectorant, and cough relieving are important, taking into account the lower yuan in this prescription. 苏子 reduce gas and relieve asthma, expectorant and cough, and it is a keen medicine. 半夏 dryness and dampness reduce phlegm and reduce inversion. 后破 qi and white chest to remove the fu. 前胡 qi and phlegm and cough. 肉桂 warms and lowers the phlegm, suffocates and relieves asthma. Dongri both cure cough and qi and nourish blood and livers. With Rougui, they can warm up the effect of deficiency, licorice, and reconcile various medicines. The third is Yue Bi and Ban Sha Tang. The prescription consists of Ma Huang, Shi Gao, and Jiang Zao Cao. Ma Huang expels the lung, clears the lungs with graspa, removes phlegm, and reconciles the spleen and stomach with Jiang Zao Cao. Judging from the composition of the prescription, the power of clearing heat and eliminating phlegm is not strong. Therefore, sometimes Sang Bai Pi decoction, Ding Chuan decoction, Qing Jing Hua Tan decoction, and so on are selected as representative prescriptions. Pay attention to the differences and connections between them. The fourth is Bufei pills. It is composed of Sang Bai Pi, Shu Di Huang, Ren Shen, Zi Wan, Huang Qi, and Wu Wei Zi, and it is used as pills. The prescription is characterized by supplementing the lungs and spleen, clearing the lungs and eliminating phlegm, and relieving cough and asthma. Coughing for a long time, much phlegm, stagnation, shortness of breath, spontaneous sweating, hot when cold, easy to catch cold, pale tongue, weak pulse, especially suitable. Personally, I think that as a basic prescription, it is very suitable for clinical application in the stable period. In addition to traditional medical treatments, COPD emphasizes comprehensive treatments, such as acupuncture, diet therapy, and psychological guidance. Aged COPD is often accompanied by anxiety and depression, which not only aggravate the symptoms of dyspnea in the elderly, but also affect the lung function status and quality of life. Therefore, patients should have a positive attitude to life, reduce their loneliness, ease anxiety and tension, and establish self-regulation to overcome disease. To give full play to the role of traditional Chinese medicine for lung rehabilitation, currently more commonly used such as Tai Chi, Ba Duan Jing, Liu Zijue, etc., can improve the clinical symptoms of COPD, improve the quality of life. Okay, that's all for today. Thank you all.